Nicola, thank you so much for joining us here at EHI Live today. Just like to kick off with an initial question. Why do you think GS1 is so important?
I think GS1 is being confused with barcoding, but really it's all about data standards. And the real issue for, I guess, the NHS and healthcare is that they cannot really compare data across systems. And the first step to that is having data standards that we will apply to so that we can actually see data across systems and actually understand what's going on, where products are, where patients are, where costs are. And that's why it's so important really for the future of the NHS.
Well, that's interesting, and so taking that one step further then, could you tell us about the current state of GS1 messaging within the UK?
Yeah, I think GS1 have done a really good job and continue to do so. I believe that the messages probably haven't got down to all the parties in the NHS that need to go so far. Certainly got through to the procurement and supply chain authorities, but it does really now need to get right through to the front end of the clinical people and those really frontline staff so that they understand what it's all about as well. It's not just about getting nurses to scan things, it's a whole bigger picture, and that bigger picture needs to get through to that front line. So there's still some work to do, but I think it's a really good start from where we are.
Could you tell us a little bit about inventory management and what it means to GS1 standards and messaging within the UK?
From my perspective, there's 3 government initiatives, which is a track and trace to be able to track products from the supplier to the patient. There's the e-procurement strategy, which is about making the whole replenishment process more visible and more efficient. And really, then the third aspect is really understanding cost drivers within the NHS, so patient level costing, service line reporting, and ultimately clinical pathway costing. And really core to that is really understanding where product is, how much it costs you, and who you used it on. And that's really why I believe inventory management is the core stepping stone to be able to make those improvements through.
And you've spoken a little bit around the key drivers and what's happening within the NHS, so could you just tell us what exactly Ingenica Solutions do?
Yeah, so we've got an inventory management solution, but I suppose the longer term picture for us is a bigger back office solution. We've got 7 trusts looking at inventory management, and we're able to look at different forms of inventory management, whether that's a top-up process, a reorder process, or even demand-led planning. I do believe the NHS needs to look at demand-led planning in the ultimate, so that gives us flexibility over other systems in the market. But also it allows us to develop on and add on products that complement that in terms of materials, resources and planning. Actually what the NHS needs to be able to do is bring those together, so your nursing staff, your equipment and your materials for to perform an operation or to fix somebody. So basically it's about more than that. So it's looking at asset tracking, it's looking at loan kits, it's looking at catalogues. All the elements that work around that core inventory management are sort of like the next step for us as well. But yeah, we're working with 7 trusts at the moment and hope to have a few more on board soon.
And just lastly, what do you think's next then for GS1 messaging and standards moving forward?
I think it's obviously they've got to get the message out, it's a big job. But it's also making sure that the technology that's available to the end user, that they also understand that they're making good choices about technology that's future-proof as well. There's solutions out there, but they're old. And actually, will they survive the next 10 to 15 years and the new technology that will be coming through in that time frame? Even in my lifetime, I've seen an absolute revolution in technology and what it can do. And the NHS needs to be making choices today for those decisions in the future.
Thanks once again for joining us at EHI Live here today, and I hope you have a good rest of the show.
You're welcome, thanks very much.